before you can start a line, you have to know what's in your hands. The Roman 4 kit looks like a jumble of plastic the first few times you open it. A bag of fluid, a tangle of tubing, a fistful of catheters in different colors. But every piece is there for a reason. And once you can name each one and say what it's for, the skill stops being scary and starts being a sequence. So this section is a guided tour of the kit. We'll cover the fluids you'll hang, the administration set that carries them, the catheter that goes in the vein, and the small supplies that make it all clean and safe. Start with the bag. At your level you're hanging isotonic crystalloid, salts dissolved in water at about the same concentration as the body. So the fluid expands the bloodstream without pulling water across cell membranes. The two workhorses are normal saline, which is 0.9% sodium chloride, and lactated ringers. Both replace volume, neither carries oxygen. You'll also see D5W, 5% dextrose in water. It's a special case, isotonic in the bag, but once it's in, the sugar is burned off and it turns hypotonic. D5W is rarely run on its own. It's usually a carrier for medication infusions. The fluid only helps if the bag is good, so check it before it ever touches the patient. Read the label, is it the solution you actually want? Check the expiration date. An out-of-date bag goes back on the shelf. Hold it up to the light. The fluid should be perfectly clear, with nothing floating, no cloudiness, no discoloration. Squeeze it gently and look for leaks or a torn outer wrap. Because once that wrap comes off, the clock starts, and the bag must be used within 24 hours. Clear, in date, sealed, leak-free. 4 quick looks that catch a contaminated bag before it becomes a contaminated patient. Now the tubing, the administration set that moves fluid from bag to vein. The number that matters is the drip rate, printed right on the package. How many drops it takes to make 1 milliliter. Sets come in 2 families. A macrodrip set delivers 10 or 15 drops per milliliter through a wide opening. Big drops, fast flow, your choice for volume replacement. A microdrip set delivers 60 drops per milliliter through a tiny needle-like orifice. Small drops, fine control. And that's what you reach for with pediatric patients or any time you need a precise, slow rate. Same job, 2 speeds. Match the set to the patient. Picture the 2 side by side. The macrodrip chamber has a wide opening, so a milliliter of fluid falls as just 10 or 15 fat drops. Fewer drops, more volume per drop, fast delivery. The microdrip chamber has that fine, needle-like orifice, so the same milliliter breaks into 60 tiny drops, many small drops, slow and controllable. That ratio is the whole point. With a microdrip you count more drops for the same volume, which is exactly what lets you dial in a precise rate for a child or a fragile patient. Macro for volume, micro for precision. Remember the numbers and the choice makes itself. Whichever set you pick, the parts are the same. At the top is the piercing spike, sterile and sharp, that you push into the bag's access port. Once that cap comes off, use it or bin it. Below it hangs the drip chamber, the little see-through cylinder you squeeze until it's about half full, so you can actually watch and count the drops. Running down the tubing is the roller clamp, your throttle that you roll to open, slow or stop the flow. One more set to know. Blood tubing, a macrodrip with 2 spikes and a built-in filter, designed for rapid infusion and for running blood. Into the vein goes an over-the-needle catheter, a hollow plastic tube riding on a needle. You puncture the vein, slide the soft catheter in and pull the needle out. The size is the gauge, and here's the rule that trips everyone up at first. The smaller the gauge number, the larger the bore. So a 14 is fat, a 24 is thin. Bigger bore means faster flow. For most adults, an 18 or 20 is the sweet spot. When you're chasing serious bleeding and need volume fast, go larger, 18 or bigger, ideally for blood. For children or fragile, ropey veins, go smaller and gentler, 22 or 24. The last handful of items round out the kit. A tourniquet, a flat latex-free band, goes a few inches above the site to engorge the vein. Snug enough to slow venous flow but never to cut off the pulse. And it comes off the moment the line is in. Antiseptic preps the skin, clean the site and then don't touch it again. Tape or a securement dressing locks the catheter down so all your work doesn't pull out in the ambulance. And the sharps container is non-negotiable. The needle goes straight in, every time, no exceptions. Fluids, set catheter, supplies, that's the whole kit. That's your tour of the toolkit. You can now open the kit and name every piece and say what it's for. And that's the foundation the actual stick is built on. Next section we put it to work, choosing a site and getting the line in. Everything you'll want to read more on for this section is on screen.